Okay, so we're going to be starting our interview. This is Johannes Ayaleo. I work at APAAA. I'm a prevention coordinator, and today I'm joined by Lena Soje. Lena is not a new face for the HIV and AIDS sector and for the entire public health sector in Canada. And she has been working in the sector for a long time, and she has been very helpful for smaller community agencies like African Partnership Against AIDS. And we've had her in many of our workshops, and then we really enjoy her presentations and speech around very useful information for our community. And welcome, Lena, to APAA's podcast and YouTube interview for HIV prevention.
Well, thank you for having me. APAAA is dear to my heart, so whenever you guys call, I try my best to give back and to really support my community in any ways that I can. So
Thank you.
I'm happy to be here this morning.
Yeah, thank you so much. So, like, the focus for this interview is mostly around HIV treatment, and we have been doing a lot of basic HIV education in the community, and people also give us questions about it. People want to know more about the treatment, you know, how helpful it is, and what are the treatments available in Canada, and some other related topics around it. And then we have few questions. So, but before we go there, I just want to start asking you to tell us about yourself.
Okay, so what do you want to know? My name is Lena. I've been involved in HIV for almost 30 years, both personally and professionally. I've done a lot of work. I've worked in ASOs. I've been on part of, I'm one of the mentors for the ethno-racial treatment community access. We do training for ETSN. We train ethno-racial communities, peers to go out and do work and support others in the community living with HIV. And a lot about the work we do is around treatment and treatment advocacy. So yeah, that's something that I've done a lot of. I'm very experienced in it, and I keep up to date with the new treatment because, as you know, things revolve as HIV. The longer people live with HIV, the more treatment changes. So yeah, I actually worked for Black Cap for a number of years, more than 10 years. I've been on boards. HIV is really dear to my heart. It's something that I'm very passionate about. I want to make sure that the Black community has the information and the access when it comes to HIV treatment and support. So yeah, thank you.
Thank you. Yeah, like you've mentioned, you know, our community members need a lot of information around HIV, specifically around treatment. So what are the treatments available for people living with HIV in Canada right now?
Well, I mean, HIV treatment has we call it combination therapy, antiretroviral treatment. Some people call it HAART, some people call it HIV treatment, but there's a vast increase in the treatment for HIV for people living with HIV. So in the beginning of HIV, there was only two set of kind of treatment that we used to use, which we could go into it later, but we used to call them nucleoside or non-nuke and nuke. Over the years, HIV medication has drastically increased in terms of there's so much vast amount of medication you could choose from the different classes, and we could talk more about that. But the way how treatment works now is that you have a combination of treatment. So that means that it's not one treatment. There's you might be taking one pill or tablets, as some of us refer to, but it's a combination of different pills in that one pill. So it makes it easier because before, a long time ago, people used to be taking like 10, 12 pills a day. Now you could just take one, but in essence,
has everything.
In essence, everything is in that one. So that's really great for science and the improvement in medication. Yeah. Also, the side effect is less hellish, but there's still, as you know, all medication have side effects. So we could talk a bit more about the side effects later on. Yeah.
Okay. So we are working mostly with marginalized community members who wouldn't have otherwise the means to access information. Just think about someone who found about their HIV status recently. What would you tell them about the importance of starting on their treatment?
Well, I think research has shown that if you start on your treatment as soon as you get diagnosed, you are able to control the medication. Your viral load become undetectable, and your CD4 count does not plummet. We'll talk about what that means later on, what is CD4 and what is viral load. But basically what it means is that if the sooner you go on treatment, the better you have, the better life expectancy you have, and the less likely you have to get sick, or you get the virus undetectable, so you don't pass on the virus, you don't transmit the virus to your sexual partner if you're having children, to your children, or those things. So the research shows that it's important to go on treatment as soon as you get diagnosed. I also think so in a way, but I also think that you don't just rush on treatment without really getting to understand what it is like, because taking treatment is like taking it every day for the rest of your life, right? So you need to be in a space and understand what that means for you. Also, I think it's important to actually have some kind of knowledge before you start treatment. You don't have to be an expert, but you need to have the basic knowledge. What does that mean for you? Are you able and ready to start treatment? So even though it says that the first thing I would tell somebody is that HIV is not a life sentence. HIV is not a death sentence. You wouldn't die with HIV. You could live a long, productive life having HIV, as long as you get into have treatment and care and support. It's important that you have that. So it's not only the treatment, but you also need to have care and also have the support to deal with a diagnosis of HIV. I mean, a lot of times we hear people say, oh, HIV is just like the common cold. It's not a big deal. It is a big deal. And it's not just like the common cold, right? I mean, there's a lot of stigma around HIV that you don't get with any other illnesses. Like, any other illnesses. People could go and tell somebody, oh, I have cancer, I have this, I have diabetes. And people will say, oh, I'm so sorry. What can I do to help? You tell people you have HIV and they run, right? Basically, that's the reality. We could pretend that it doesn't exist, but it does. Right? So that's one of the things I want to make sure that somebody who's newly diagnosed have the support and care to deal with this, because it's a long haul. It's all the rest of your life, right? So yeah.
Yeah, I really like the point you made about the stigma around HIV medication. We've had, a lot of people, some of our clients told us their experience around treatment. I mean, stigma because of the treatment they're taking. Some of them, their roommates left them just because they saw the medication that you mentioned at the beginning, that it's so visible that it was a lot of pills at the same time. So these are really good points that we will keep discussing about. But I like the point you made about understanding of the treatment is very crucial before you start.
Yeah, so, I mean, I work with people and you would ask them, what medication are you on? And they would say, well, I don't know, I think it's a red pill or a yellow pill. And I was like, hey, you need to know the basic. You need to know the pill that you're putting in your body at least. You don't have to know all of them because there's a lot. But no, and the information is out there. I mean, Katie is the best place. You just, anything you want. You want colors? If you take the red pill, put the red pill in at Katie and it will tell you what it is. So I think it's important that people know what they take in. It is, you don't have to know everything, but have a basic understanding of what it is and what it does to your body.
That's true. Yeah, the understanding of the medication is crucial for people before they even started. But after starting the treatment, staying on treatment is one of the most important things that we need to talk about. So what do you recommend as a general practice, as a good practice for people to stay on treatment?
I think staying on treatment is very important, but I also think you need, before people go on treatment, doctors or healthcare provider or their peers need to really explain to them what it is like to be on treatment. And as I said earlier on, being on treatment is a lifelong journey. It never stops. You can't take a drug holiday. That was the thing of the past, and I think they tried and it never worked. It's not that. You have to take this medication every day for the rest of your life. You're going on vacation, you have to go with it. You're going on visit family members who don't know your status, you have to go with it. You have to lie, maneuver, do whatever, put it in different pill bottle, whatever you have to do when you're taking those medication. If you're to travel, you need to think about how you're traveling with medication when you get to the border. All those things you need to really know before you start medication. You need to have a place, a secure housing or a place to stay. You need to be able to know how do you pay for your medication, whether it's Trillium, whether it's ODSP, whether it's your work insurance. How do you pay for that medication? What is your if you, for example, Trillium, are you able to pay your deductible? Where can you get help paying those deductibles? These are things that you need to know. I feel like you need to know before you start taking medication. It's easy to say, oh, treatment is available, you get the treatment, take it, and you stay on it. But how do you stay on it when you don't have a place to stay? You don't have food, you live in a shelter, you're worrying about your children or your spouse, you're in an abusive relationship. We have all these things that we need to really focus on and get people ready so that we don't set them up to fail, right? We don't want them to fail treatment. We want to make them. And another thing I want to talk about is like in terms of like young people, children, youths, people who were born HIV, for example. A lot of the times they were on treatment when they weren't followed in the pediatric hospital, but when they transition, because of that transition process and the way how the transition goes, and they get lost in the system, and in the adult hospital it's totally different. They may again fall off the treatment, they may stop taking the regimen or whatever. These are some of the stuff we need to do a lot of work in different areas to get people to have the information and the support they need to stay on treatment. So staying on treatment is critical. I mean, if you stay on treatment, you have your viral load is undetectable. You go make sure you have a good doctor, somebody you could talk to. Be honest with them. If you miss your dose, you say, you know what, I missed my dose. Do not, you know what I mean? You have the and you know that this doctor will be compassionate, and he would support you in terms of like, give you the tools that you need, or ask you to see a counselor, somebody to help you to manage those kind of pieces that you're struggling with. But it's important to be honest and to get somebody that you're honest with, because you have to be honest with yourself. You have to be also compassionate to yourself, because not all the time you feel like taking medication. And I'm not saying it's okay to miss medication, but it's okay to be truthful to your healthcare provider and say, you know what, I messed up. I didn't take it for a weekend, or I didn't take it for the week, or whatever. Yeah. And know that that person is going to support you with like, okay, can we talk about what are some of the issues was preventing you from taking it, and all those things. Yeah. And I think if you have those things in place, you could really do really well on medication, taking your treatment.
Yeah, sometimes people can also forget, right? I mean, what are the things that they should do just not to forget, like in terms of scheduling themselves?
Well, I mean, people use different things that work for them, right? Some people use a pill bottle. Some people take their medication before bed. Some people take it early in the morning when they're brushing their teeth. Some people use alarm from their phones. People use whatever techniques that works for them. What works for one person may not work for the other person. So I guess engage in the person and find out what would work for you, what would support you in making sure that you take this medication. What are some of the things you need to know before? What are some of the struggles you're having? How can we support you to put the tools that you need in place to help you in making sure you take those medications? So I think knowing that everyone is different, what worked for somebody else may not work for me, what worked for me may not work for you, what worked for she may not work for they, you know what I mean? So I think it's important to it has to be an individualized process, and it has to be what that person wants, what works for them, and not works for us, what we think is best for somebody. Yeah.
I'm glad also you mentioned the role of service providers in this for giving support for people to stay on treatment. That's a good point you raised.
And I think service providers are very important. Yeah.
Yeah, we've been talking about only from the side of the the clients, and I'm glad you mentioned about the role of the service providers.
I have been in the role of a service provider, and people will disclose stuff to their service provider that they would not disclose to their doctors
Yes.
or our other healthcare providers. So it's important to have that open communication and open, suspending judgment, and making sure that the person knows that when they come to you, they could tell you the story, and they're not going to be feeling judged or ostracized or condemned or whatever, that they could tell you. And I think a lot of people trust their service providers and their peers to be honest and have open conversation with. And I think then the service provider like encourage them to talk to the healthcare provider or even go with them.
So, so far we have been talking about starting people on treatment. What are some of the things that helps them to stay on treatment? Where are we heading to? Which is mostly we call it undetectable status, right? So we're heading to the U equals U thing. So many of our clients would hear the word U equals U. Can you break it down for all of us?
So basically, U stand for, well, undetectable. So if you're undetectable, you're untransmittable. So that means, what does that mean is that if your HIV is under control and they cannot detect any, when they do the test, they cannot detect any HIV in your blood. That doesn't mean that you're HIV cure. It doesn't mean that you don't have HIV. You do have HIV. It's just that your treatment is working so well that you cannot transmit HIV to your sexual partners, right? That's what it means. EU equal U. Undetectable means untransmittable. So you really cannot transmit the virus. Research shows that, and we know that Toronto is working towards getting to the 90% of people living with HIV, should they said in 2020, I think. Well, we in 21.
They just revised it to 2025.
Oh, 25
and
now.
Yeah, 2025.
I
So
thought it was
that
23.
390s,
Yeah.
they just revised it to
Yes.
2025.
So
UNAIDS.
yeah, where they said that 90% of people living with HIV should know their status.
Yes.
And 90 people diagnosed with HIV should have treatment, have access to treatment, and 90% of people should have suppressed viral load, right? So that's the aim. So I think we are going in a really great direction for some people. Because when we talk about 90, 90, 90, and we talk about undetectable U equal U, we also have to look at, are we all, is it equitable for everyone? Do we all have access to becoming undetectable, right? And what does that mean when we talk about what are we doing? Are we supporting people or ostracizing people for not getting to that point? So I think those are some of the things that we need to look at. And then another thing is like, okay, we talk a lot about U equal U in the context of like, well, okay, if I'm undetectable, I'm untransmittable when it comes to sex. A lot of times sex is not the be it all and be all for certain people. Some of us, we would use a condom. We like a condom. We don't have a problem with using the condoms and whatever. And I get that. I'm not saying that people should not strive to get to that place, but I'm saying that those who cannot, what happened then? Like, where are they in that spectrum, right? I think those are some of the things that we need to really think about. And in our community,
Yes.
when it comes
I was going to come to that, because we're talking about U equals U in general, and then we need to talk about specifically about the African Caribbean Black communities. What are some of the unique opportunities and challenges we have in the ACB community when it comes to achieving the undetectable status?
Well, I think I could talk about the unique opportunities we have. I think agency like APAAA and Black Cap and Women's Health and Women's Hands, and they have made inroads. They have survived the stigma, the discrimination in terms of even renting space, and being able to say, look, we are here. And I've done a lot of good work in supporting the community, right? The Black community. So Black people know about ACB community, knows about these agencies. So I think like stepping it up and bringing the information to our community. I mean, I don't have to say it, you does it a lot. I've seen you in terms of Afrofest, Caravana,
Right.
those pride, just being where our people are in spaces where they congregate
Yeah.
and getting the information to them, whether it's those big events or whether it's smaller events, right? That get the community there. So I think those are the unique opportunity that we're talking about, that people trust us, that we could bring those messages there and they would listen and hear, and really they value what we get. They don't mistrust us because it's coming from somebody that looks like them, speak like them, are part of their community. So the person is not coming to harm them. They come in to bring them information and they care about their well-being. And when we go out there to do those kind of work, we don't just talk about, oh, to prevent yourself. We want to know how they're doing emotionally, physically, spiritually, mentally. We want to know how they're doing. So we're not just about pushing the information about prevention, but we want to make sure that we are getting the prevention message, but coming from a holistic way. And I think people appreciate that. They know that we care about them, right? And that's why we are here out there. I think those are some of the unique opportunities we have. We have established ourselves in the community for so long, worked very hard to get a space at the table in different places where our community know us, they value us, and they appreciate us. So I think that is some of the uniqueness. I think the challenges are that we don't have the same resources as the big agencies does, right? And we are mostly scrutinized more. We are mostly we all are not coming from the same playing field. Like some people have a head start while we don't, right? And I think that those are some of the challenges. We have to work hard to get our community. Our community don't come to us. Whereas other agencies, they have their community, that the people that just come to them, walk into their space. We have to go out and search and find our communities, because again, it's not about they trying to hide, but they have lives. They have multiple jobs. They're not on the same schedule like we are. Our agency are 9 to 5. Some of them work. They have 3 jobs. They work shift work. They don't have access to taking days off, because if they take days off, they don't get paid. So, I mean, we see it with COVID. Look at the people who were working during the COVID time, right? Mostly you go on the subway, it's all racialized people you're seeing. You know what I mean? Like, that's the reality. I was on there and I was looking and I was like, wow. You know what I mean? You know who was doing the work. So that's something that shows us that our communities, they are scattered, they're working, they're busy, they have to hold down so many jobs, and we have to go out there. So I think that is some of the challenges, meeting them where they are on their own time, getting the time and space to really have conversation and all those stuff, access to those things like PrEP, all those the treatment. Like, okay, if I have to go see a doctor and I'm working shift work and I finish work at 6, where's open at 6 o'clock? What time do I see my doctor? You know what I mean? Those kind of things we have to think about, right? When we looking at the challenges our community are facing, right? Racism, homophobia, all those things are out there. You know what I mean? Are we our space telling people that it's okay for them to come in here? People who use substances, people who are marginalized in whatever area, like I work with a lot of people that are like seniors now that are HIV positive, and one of the challenges is like, what do I do now? I may have to give up my home. where I'm going, do I have to disclose to where I'm going? So these are things that we haven't looked at and we haven't addressed, and these are some of the things that we really need to look at in making sure that people get to the undetectable and untransmittable.
Thank you. Those are really good points around the challenge that the ACP communities are facing in terms of individual challenge, and as well as you really nailed it when you talk about the institutional challenge, the disparities between other organizations and organizations serving African, Caribbean, Black, and other marginalized communities. So we discussed a lot of points about treatment. So where else people can get information about treatment? I mean, they can come to APAAA, Black Up, or any other organizations. But is there any other resource that you want to mention?
Yeah, I think For me, I would say the most reliable, vetted, respectable places, I think, besides your local aid service organization where people usually go for information, is CATI, the Canadian Treatment Information Exchange. I think so.
Yeah,
Information exchange.
CAIA.
Yeah, yeah,
Yes.
Katie.
Yeah,
Yeah,
Katie,
I was
yes.
just kind of like in my head.
Yes.
But yeah, I feel like when it comes to anything HIV, I
Yeah.
just Google it and put in Katie and just say, I need this information, and so much comes up. And they have it in so the languages are easy to
Very simple.
understand, easy
Yeah.
to, yeah, very simple, accessible. You know what I mean? They have different vignette to show you what and all these other stuff. So I think I would say Katie. There's also the OHTN. That's
Oh,
it.
OHCN, yes.
Yeah,
OHCN, yeah.
yeah,
OHCN has a good information too.
yeah.
Yeah.
So those are
Yeah.
the places that I would say because they're Canadian based, right? They
Yes.
trust it, and you could know that it's not American because we are
Not
different.
CDC.
Yeah, it's not the
Sin is
CDC.
not CDC, yes.
Ministry of Health, I would say,
Yeah.
not public health. Not that public health is bad, but the Ministry of
Yeah.
Health have a lot of information that is coming from Katie, and it's peer review as well. So that's a place that you could get some information. But mostly, I would say I usually just stick to Katie because I get everything there. I don't
Yeah.
go if I go on APA website or Black Cap website or
That's it.
Community for Accessible AIDS Treatment. Yeah,
Yes.
they also have a lot of information. Another good place to get information about HIV treatment is your support groups because people talk. They talk about side effects. They talk about what works. They were on this one, and you hear from this one. Yeah, me too. You know what I mean? So those are the things that your good resources is your support workers. They have like tons of information. A lot of them have been in the position for many years. So they hear stories, they know what works. So these are places that you could really trust, and peers. They're like the vast, they have like lots of knowledge and information because as I said, some of them are trained to do that kind of work and some of them through their lived experience could tell you. But yeah, so those are
Yeah.
yeah, I would say.
Yes. Yeah. Is there any other point that you want to raise around? It can be around treatment or related to HIV prevention or anything. Any
I
other point you want to just pass on to the community?
I think that I mean for me I just kind of like it's really sad for me that HIV is still a big issue in the community, in our community, and we seems like we can't get a hold of it on it, like to get the rates of infection down. And I think for me, I would say that even if we are trying, there's so much more work to be done, and with it, and we cannot do this by ourselves. We have to work together as a community to get it done. And as long that means involving every aspect of the community. We also need to look at not before we used to look at HIV like we a little cocoon in our little community. Now we need to broaden that, involve other healthcare providers because people don't just struggle with HIV. We talk about side effects of HIV, right? So they're not just, okay, I'm just seeing my specialist, my HIV specialist, and that's it. But they may have to see somebody for the diabetes. They have to see somebody for the hypertension. They have to see somebody for whatever reason, some of the side effects of the medication. And we want to make sure those people have the knowledge and the information about when somebody's living with HIV, what are some of the experiences, and also that they don't re-stigmatize the person when they walk into your space. So I think all those kind of work that needs to be done will help us to get to a better place when it comes to HIV. Yeah.
Thank you, Lena. I learned a lot myself from this interview, and I'm sure many of our community members also get grasp some ideas. They get some motivation to stay on treatment, to take care of themselves, to reduce some of the side effects, and then they get some information about some of the resources that they can go to. But as APAAA, we continue also to provide information anytime anybody need information around it, whether it can be HIV treatment or accessing some of the safer sex resources. They can always check our website, www.apaa.ca. And I really, really thank you, Lena, for taking the time to talk to APAAA. And if you want to say anything or
Yeah,
any message for our community.
I just want to say, if you are living with HIV, know that you value, you're worthy, and you're worthy to live a healthy and happy life. And APA, as Johannes said, and other agencies are there to support you in your journey. And also to be compassionate and loving towards yourself. If you skip medication or you fail and you stop taking medication, you could always go back. It's not the end of the world. There is so much treatment there. If you're your doctor, you feel like you develop resistance to one, there's so many new ones that you could try. So do not give up. It's a continual journey. Continue. There's tons of love and support out there for you, and I wish you all well.
Thank you.
Take care of
Thank you.
yourself.
Thank you. That's a very powerful message to end our conversation around treatment. And as APA will continue to bring people into our podcast, into our YouTube page, please continue to visit our website for all this. But I just want to thank Lena Soje again for coming and giving us all the
Thanks for having
education
me.
that we need. Thank you so much, and all the best.
You too. Bye bye.
Thank you. Bye.